Hi, everyone. A warm welcome to all of you on behalf of GFAN AP for joining us from across Asia Pacific and beyond. This is our fifth GFAN AP partner updates call this year and part of our efforts to keep our partners updated and informed about the work of GFAN AP, including our joint efforts in supporting their 8th Global Fund replenishment. My name is Jennifer Ho. I manage operation and program at GFAN AP, and I'll be guiding us through today's call. Next slide. A couple of quick reminder before we get started. This call is held in English, and to help run things smoothly, please keep your mic muted and cameras off. If your internet feels a bit slow, try closing other apps and feel free to drop comments and reflections in the public chat. Please note that this call is being recorded and will be shared later. And as always, GFAN AP is committed to keeping this space inclusive and safe for everyone. Okay, next slide. A bit of an overview of what we'll be sharing today. First, we'll get some updates from Rachel Ong, the regional coordinator of GFAN AP, on GFAN AP's work in the third quarter of 2025. And after that, we'll hear from Ernest Waitutu from the Global Fund on the recently launched results report 2025. And Charlize Scholar from the Global Fund will also be joining us in a little bit. She will be updating us on the Global Fund communication relating to the replenishment this year. So without further ado, let me first then invite Rachel to the floor to provide some updates on GFAN AP's work in the third quarter of 2025. Thank you. Over
Great,
to you,
thank
Rachel.
you. Thank you so much. Maybe we can just remove the background slides for now. Thank you so much. With last spoke in May, GFAN AP provided a quick update around the work that we were doing. Since then, we've been able to do a lot more, mostly with all your support. I see that Ika's with us right now, as well as other colleagues that were with us in various events. Our Japanese colleagues send their apologies for not being able to share with us some of the great work that they're doing around advocacy with the Japanese government, but we'll share a very quick update on that as well. So since May, we've actually been able to support some of the advocacy efforts with Japan through the APEC. Ika, who's on the call with us, was also with us there, and Jennifer as well, in various activities with the Diet, with the parliamentarians, and as well during the APEC conference. We then actually had a advocacy moment as well at the Malaria Summit, which was co-organized by APALMA, the Asia Pacific Malaria Leaders Alliance, and hosted by the Indonesian government. We had then produced a video which was unfortunately unable to be shown at the summit, but it's also available for advocacy efforts on our various social media platforms. Happening very soon after that, which was just last month, was TCAD, where our Japanese colleagues supported our African colleagues as well in some of the advocacy to the Japanese governments with meetings at the Diet, including a session that was co-organized by our Friends of the Fight Japan, as well as our Japanese colleagues that was attended by Bill Gates. So there was a declaration was released from TCAD, which we also worked with our African colleagues and our Japanese colleagues on in producing a reactionary statement to that. We've also then worked on various global sign-on letters with all your support, including Spain and Germany, and also for South Korea. At the Malaria Summit that was held in Bali, Indonesia, Ani Hernasi, who is a GFAN Bureau speaker, and also produced a fabric, which I think has already had a video produced as well by the Global Fund Secretariat, which you can also have a look at. There were also many different products that were produced with through Ani's workshop, which actually includes a tote bag, includes pouches. Those were delivered to some of the decision makers at the Malaria Summit and will be continued to be delivered in other various events. We have also finalized and launched in the last 2 or 3 months the Learning Hub a Learning Hub page that actually supports and provides information around the Global Fund's replenishment efforts. So these are very quick highlights around some of the main things that we've done in the last few months. Just for your information as well, our Japanese colleagues shared with us fantastic news this morning around being able to provide to the government of Japan, to Mr. Hisashi Matsumoto, the Parliamentary Vice Minister of Foreign Affairs this morning, 6,713 signatories through a statement that they had co-organized as well with colleagues from APEC, that they would be sharing more social media updates on. And Masaki's information to us would be that they are also submitting the same petition to the Ministry of Health, Labour and Welfare this evening, which is why he sends his apologies for not being able to join us today. We will follow up with all of you as well as our colleagues in Japan, further advocacy efforts. But his initial feedback is that he was actually really pleasantly surprised around the positive response from the Parliamentary Vice Minister around Japan's pledge for the Global Fund. We are working with our Korean colleagues around producing a reactionary statement for the APEC high-level meeting and the World Bio Summit, which has just happened and ended yesterday. And we would be looking forward for our colleagues to also help amplify some of these messages. Up on our calendar would be some letters that we would be sending through all of you at country level, and you will be receiving more information on some of these countries very soon, including Sweden, Canada, United Kingdom, US, Japan as well, and possibly South Korea. So these are some of the initial things that we would be looking at in the next couple of months. And I'm going to pause there if there are any specific comments or questions from colleagues. I do not see our colleagues from India with us, but they had also worked on a really amazing event that included some colleagues from the private sector as well as foundations in the last couple of weeks. We are also working with our Indonesian colleagues to see whether we can finalize some sort of an embassy event in the coming months. So I'm just going to pause there and see if there are any specific questions from any of our colleagues at this point. If not, I would like to ask whether Ika would like to share anything from APEC or Jennifer from APEC as well.
Ika, over to you.
No, I don't have anything to add. Thank you, Rachel.
Thank you,
Likewise.
Ika.
Yeah, likewise, Rachel. Thank you.
Great. Then over to you, Jen, for the next section, which we have Ernest.
Great. Thank you so much, Rachel, for that update. And again, please feel free to reach out to Rachel, myself, or Ken, any one of us on the team, if you have any questions, comments, suggestions for our work going on as well. Next, I would like to move on to Ernest Waitutu from the Global Fund, here to share with us the results report 2025. So I think Ken will be helping with the PowerPoint slide, and let me turn the floor over to Ernest. Ernest, over to you. Thank you for joining us today.
Thank you. Thank you so much, everyone, for this opportunity to always, to share the progress we are making as a partnership. I always want to reiterate as I get started in presenting this report that this is not the results of the Secretariat, it's the results that we have all achieved as a partnership. And then before I get deep into the report, I also wanted to mention the resources that we have that can help you access this report in different ways. The first one is that we have a big PDF, usually about 100 pages. So if you're one of those people who want to sink their teeth into the report, we have that PDF. Then we have a 2-pager, what we call at a glance. This one comes in 10 languages. It's really boiling down of the PDF into 2 pages. It comes in 10 languages, including Arabic, Korean, Japanese, Chinese, all those multiple languages, French, of course, Spanish, in 10 languages. Then we have a video, and I know Charlie will share that a little later, which sort of, it's the achievements that we have made in the last 2 decades in one video. These slides will also be available if you want to look at those. And then finally, we have a web version of this report. If you go on the Global Fund website, theglobalfund.org, on the front page is the results report. And with the web version, what you can do is you could be able to query different countries. If you are interested, for instance, in Cambodia, you could go in there and check what achievements we made in Cambodia, how many people are on treatment there, how many people are treated for TB. So you could go in there and query country by country. So those are the resources available. We also remain available to explain, answer questions. Rachel knows how to reach me. So if you have more questions, you can let us know. On into the report now. Let's get in there. And the first thing to mention is the woman on the cover this year is from Nigeria, and this is a malaria event, distribution of mosquito nets and seasonal malaria chemoprevention, SMC. She's called Shiwafu in northern Nigeria. We know Nigeria still has a huge malaria burden. 39% of malaria cases in the world, actually deaths, happen in Nigeria. So that's for children under 5. Next slide. And before I get into the numbers, one thing I wanted to highlight is you will see that in this year's results report, Peter's letter, which is usually the ED letter, the ED letter in the results report is often an editorial of what the report is about. But you'll see one of the things we have done in this year's letter by the ED is to sort of articulate what we would call the change narrative, how the Global Fund is changing. We know that many organizations are challenging themselves to change in this time. And you'll see that in this letter, Peter articulates, that's in the PDF, Peter articulates the change narrative and the place, the pathway that the Global Fund is on in terms of challenging itself to change. We also highlight the reprioritization that has happened in the last few years, in the last few months, given the funding cuts. The point we are making is in this chapter is that we are recalibrating our grants, enhancing precision, strengthening strategic frameworks for greater results. Next slide. On to the numbers, the big headline number is we are now at 70 million lives. I'm sure you've seen that number out there. But two other numbers to highlight is 25.6 million people on ARVs for HIV in 2024. That's of course a record. We keep inching upwards, in fact, accelerating upwards. And the other number that will be of great interest to people in Asia is that 7.4 million people are treated for TB in 2024. That's a remarkable growth from in the last decade. We were only being able to treat about 4.4 million people. We know that every year, about 10 million people get ill with TB. So a few years ago, when we were only able to treat about 4 million, that means we were missing about 60% of the people with TB. They were not being diagnosed and treated. You can see the progress we are making. There is huge momentum in the fight against this disease. Now, we are close to only 20%. And I think what we have seen in the last few years is momentum, both in Asia and in Africa, especially in Asia, in the fight against this disease. Let's keep going. Next slide. On to the slides I call the state of the fight, and this is the state of the fight against TB. You will see here the trajectory we are on in the fight against HIV. There is, of course, that green line. That is a global target pathway to 2030. We know the goal is to end HIV and AIDS by 2030. And you can see how we are progressing, both in terms of AIDS-related deaths on the left and new HIV infections on the right. The key thing to mention there is in the fight against HIV, we have made really great progress. This, of course, was the state of the fight in 2024. We know things have changed in the last few months due to funding, but we still feel that we still know that this is one of the areas in the fight against HIV. We can still end AIDS by 2030, which of course means, and I guess for advocates, the funding of the Global Fund, the replenishment coming up this quarter is very important. This was a state of the fight in 2024, 2025 changed, but with strong funding for the Global Fund. Ending AIDS by 2030 remains within reach. Next slide. This slide usually captures the progress we have made over the last 2 decades. It's a counterfactual kind of slide. It shows you without Global Fund funding, AIDS-related deaths would have grown by 90%. Now what we are seeing is a 74% reduction. And the same case applies on the other side. We would have seen a 75% increase in new HIV infections. Now we are seeing a 62% reduction in new HIV infections. Next slide. Very quickly, this is the cascade. And what you are seeing here is 88% where we are in the disease, in the countries where we invest. 88% people living with HIV know their status. 79% people living with HIV receive ARVs. 74% people living with HIV with suppressed viral load. Next slide. These are the key HIV stats across the report. One that I want to highlight here on this slide is the remarkable progress in PrEP. In the last year, between 2023 and 2024, we saw a 325% increase in the number of people who are taking PrEP, essentially from around 300,000 to 1.4 million. So the 2024 number was a record-breaking number, and by a big mile. We know that there were concerns when PrEP was introduced that demand might be low and people invested in demand creation. That demand creation is paying off because quite some rapid progress in terms of people on PrEP in 2024. Next slide. So state of the fight in the fight against TB, and this I know is of huge interest to people in the Asia region. So TB is not doing as well as HIV, but in the last few years, as I mentioned, in fact, in the last 3 years or so, as I mentioned, in terms of finding people with TB and putting them on treatment, we are seeing remarkable momentum. So not as good as HIV, the fight against HIV, but we are seeing really great momentum. We may not be on the global target pathway for 2030, but what we are saying in this report is that the NTB strategy 2035 is doable, looking at the momentum that we have gained in the last few years. Again, goes on to say why the funding of this partnership is very important if we are going to have a chance of hitting the 2035 NTB strategy. Next slide. Again, the counterfactual slide, TB would have increased by 134%. That is the deaths from TB. Now we are seeing a 40% reduction. If you look at the right side, you see that TB cases have actually increased. Part of that is the fact that, of course, population has grown quite fast in those areas, across the countries where we invest. But we would have seen, it's still a story of success, we would have seen a 40% growth in those TB cases. So it's still a good story. Again, TB momentum, we've seen a lot of momentum when it comes to the fight against TB, and we need to continue to invest. Next slide. One thing to highlight here is that when we find people and put them on treatment, our TB treatment success rate is quite remarkable. You can see on this slide, the middle graphic, 88% TB success rate. So the key thing is to find people and put them on treatment. Next slide. Again, key results for TB. One that I want to highlight here is the 3.4 million people in contact with TB patients received preventive therapy. This is a newish element when it comes to the fight against TB. And what you can see here is that we are really accelerating the momentum there in offering preventive therapy, which means we are preventing more people from getting TB. So 3.4 million people in 2024 were put on preventive therapy. Next slide. State of the fight against malaria. And this is where the challenge is. I think for Asia, what we have seen in the last few years, a few challenges here and there. Of course, we know the story of artemisinin resistance in the Mekong region, and we know that the Global Fund has this partnership has invested heavily in that region and in that area. We are talking countries like Laos, PDR, we are talking Cambodia, Myanmar, Vietnam, that RAI region, the Mekong region. We have seen really great progress, in reducing the cases by 99%. That is covered in this report. Again, in the Asia region, we are talking about elimination, and we are seeing rapid progress towards elimination. But the story of malaria, which is largely an African challenge, is one of stagnation on the African continent. We know that 95% of the burden is in Africa, and we have seen a stalling of progress. And if you look at the next slide, it will show you very clearly that first of all, yes, a reduction in deaths by 29%, not as good as in the other diseases. But when you look at the cases continue to grow. And if you go to the next slide, it will show you that we are not keeping up with coverage. Only 61% of people who need Mosquito nets have been covered. Again, the point about usage of those mosquito nets, only 53% are using them. So in terms of malaria, a bit of stalling there. We need to restart the progress. Again, the investments of this partnership this year, the replenishment are going to be very vital when it comes to restarting the progress in the fight against malaria. Next slide. Again, key results for malaria across the report. One thing I wanted to highlight here again is the tremendous growth of a tool we call seasonal malaria chemoprevention, much of it deployed across Africa or in Africa. For children under 5, we know that's where the big majority of malaria deaths happen. We've seen tremendous growth in terms of malaria chemoprevention from about 5 million in 2017 to 50 million, tenfold growth in the last 8 years. So that's a remarkable story. There are more statistics across the report that you can access. Next slide. When it comes to health and community systems, what has also, we have also referred in the past as RSSH, one thing to highlight is the tremendous growth of the investments that we are making in this area. 2024 was a record-breaking year. $2.7 billion invested in health and community systems across the countries where we invest. And if you go to the next slide, you will see where these investments went: health workforce, community systems, surveillance and data systems, labs, waste management, supply chains, medical oxygen. So really a huge acceleration when it comes to investments in in health and community systems. The thing to say there is quite a bit of that is reprogramming from C19, as we know, but also we have become better at counting, or at least pulling in the data that shows what we call contributory RSSH, basically what amount of funding that goes to HIV, TB, and malaria that ends up building health and community systems. So we are able to now count that quite well, which has not been so in the past, and that shows the level of investments that we are making in the fight, in health and community systems. Next slide. This slide speaks to the agility and resilience of this partnership. First of all, shown by how this year we've been able to reprioritize, but also shown in the way we are able to apply the emergency funds in very different places. What Pakistan, for instance, is one of the big countries. It's one of the countries that has received huge investments from emergency funds. We will remember the funding, the floods of last year and what that meant for the fight against malaria there. And Pakistan was one of those, recipients, or at least countries that received emergency funds to very quickly help or support the country in fighting infectious diseases. But also beyond the emergency funds, since 2002, the Global Fund has disbursed approximately $24 billion in both, in COEs, in what we call challenging operating environments. We know these are quite a few in African countries, but also in Asia, in all those areas where we are seeing challenges, either in conflict, but also challenges from issues like climate, like Pakistan that I just mentioned. Next slide. Overall, since 2002, we have disbursed about $70 billion as a partnership. So the report captures that level of, it sort of has the numbers of our level of investment. If you want to show scale, of the level of investments that the Global Fund has been making, $70 billion to date. And in 2024, the Global Fund disbursed $4.8 billion. Next slide. This slide shows the level of investments, basically the Global Fund contribution to international grants. 26% for HIV, and this is international grants, doesn't count for domestic. 73% for TB, 59% for malaria. One thing we know is that the situation is likely to look very different next year because of what has happened this year. Again, goes on to show why the replenishment, and Charlie is here, she'll speak about the campaign, why this replenishment is very, very important this year. The amount that the Global Fund contributes to international grants looked like this in 2024. We know it's going to look very, very different in 2025, given what has happened. Look at TB, and I know people from the Asia region is very interested in the fight against TB. Look at that, 73% of that comes from the Global Fund in terms of international grants. It's likely to be much, much more in 2025 and going forward. Again, very, very important that the Global Fund gets replenishment this year. Next slide. I think that's the last one. Thank you very much. Open to questions. Thank you.
Great, thank you, Ernest. And I know that people inspired had a lot of questions, but I would like to suggest that we hold those questions and go to Charlie's presentation first, and then we can take a round of questions jointly, if that's okay with you, Ernest. And in the meantime, if anybody would like to drop their questions in the chat box, please feel free to do so. So thanks again, Ernest, for that really comprehensive overview of the results report and for highlighting, especially I'm really appreciating you pointing out specific data figure relating to Asia Pacific, but also to highlight why it is even more important for us, this upcoming replenishment, and for all of us to be getting behind and supporting that. And without further ado, then let me turn over to Charlie Scholar, who is the communication lead manager from the Global Fund, who's helping to lead the 8th replenishment campaign. So Charlie, over to you. Thank you.
Thank you so much, and hi everyone. It's a pleasure to be here with you all today. Next slide, please. So as Ernest said, this replenishment, like all of replenishment, is incredibly important, but perhaps never more so than the situation we're in right now, where there is so much riding on the funds that we're trying to raise. At a time where it's the most difficult to raise them. And from a communications and campaigning perspective, this has certainly provided a challenging backdrop, and that has really impacted the way in which we campaign. For those of you who are long-standing advocates, you will know that this campaign is very, very different to previous campaigns. So I think everyone is aware at the start of the year, we had to really shift our strategy. We pulled our campaign tagline back because of the risks associated, particularly with the US, with the stop work orders. The language had a risk around it in terms of potentially being seen as inflammatory or sort of directly oppositional to the US. So we really stripped back. And we also took a decision of strategic restraint to reduce our visibility at this sort of volatile time. Today's context is a bit different. The risks have not disappeared completely by any stretch, but they have shifted. The focus is quite different. Gabby's replenishment is complete. And as we enter this final quarter of the campaign, we do feel that now is the time to increase momentum and be a bit more visible at select moments in select markets in select ways when it's going to add value. So last week's results report launch provided a very powerful hook and a good news moment to ignite momentum for this campaign's final push. So I'll talk you through how we went about that, but it involved a targeted push and influencing strategy in key markets. And part of our approach here was about unifying the different campaign strands that we had. There was a lot going on. There's a lot of campaign assets and activations. The results report was huge. And we really needed to sort of energize the activity around that and also unify the threads. One thing that we decided was that now was the time to inject this sort of rallying cry, a unifying thread back into the campaign, that piece that we've been missing for the last 6 months. We want to inject conviction and urgency at this moment in time. We want to offer decision makers a powerful call to action. And we really want to start channeling the emotion and humanity even more than we have been doing so far. Next slide. So one of the ways in which we're hoping to do this is we have reactivated Stop at Nothing. You will have seen this in our most recent activity that we pushed out last week. Next slide, please. We're bringing this back. This is for everyone to sort of get behind in their communications, but there are some parameters around it that are a little bit different to previous campaigns. So you will notice we have softened this tagline a little bit. The original one was simply Stop at Nothing. We've now got 2 versions with a bit more explanatory framing and sort of softening around it. So one version is Together We Must Stop at Nothing, which really focuses in on the collective, the partnership element, the unifying aspect of how we work. And the second, Stop at Nothing to end AIDS, TB and malaria. So this kind of resounding goal, the shared mandate and mission of the Global Fund partnership. So these are the ways in which we will be applying this tagline. It's not going to be everywhere the way Fight for What Counts or Step Up the Fight would have been, but you will start seeing it on our channels, and hopefully you saw it in the assets that you received last week. Next slide, please. So hopefully everyone saw our activity last week. We did have a bit of a groundswell moment that we hope is going to set the tone for the next few months. The results report, which Ernest has just brilliantly talked through, was launched. We've got the full report and all of the core assets associated with that. And we had a big advocacy push on social media as well. Hopefully everyone received the results report toolkit. And there was lots of thought leadership and also this link to the global media push that our PR team was managing. From a broader campaign perspective, we used this as leverage to push the campaign and reactivate Stop at Nothing. Hopefully everyone here has received the campaign toolkit that we launched this Monday. I can drop a link here if you didn't receive it. But this has all of the assets that we've been producing for the campaign, including our new campaign film, 70 Million Reasons Why. This is launched now. If you haven't already, we would really appreciate it if you help amplify this on your channels. There's also a lot of content where we're really spotlighting and heroing the people on the ground, on the front lines that are representing that Stop at Nothing spirit every day. We're also launching soon a private sector video series called Unstoppable Partnerships to elevate those private sector voices that are really important. This will kick off next week during UNGA. Next slide. So the toolkit, as I just mentioned, this is going to be your one-stop shop for campaign assets. So we are going to keep this updated from now through to the end of the campaign. So if you need anything, if you're looking for anything for your social media channels or communications, this is the place to go first and see if you can find what you need. It's broken into chapters. It's really nice and clear. So there's a whole piece on the results report. Again, there's the fabric activation, there's global health security, there's additional chapters, including the new film, there's key messages, there's lots of graphics. So we will keep this updated. We will be adding more assets to it over the few months, and then this will become the sort of finale asset bank as well. So we hope that this is useful to everyone. Next slide, please. Now a little bit on about our various campaign activations. I think everyone here is familiar with our fabric activation. This is our sort of flagship creative centerpiece of the campaign. It kickstarted with Cebu in South Africa. Her story and fabric is launched. It followed with Annie's, maybe Annie's on this call, I'm not sure, but Annie's incredible story from Indonesia. Next week, Annie's story is getting a big push in Canada as well. So we're continuing to really activate these stories, both in visible ways and also behind the scenes. We have Ivan from Bolivia and Nuruddin's from Nigeria. Their stories are well underway. They're going to be launched hopefully in the next month or so, and we will continue to be pushing all 4 of these stories. These voices are so powerful. We are getting a really great response to them so far. We're finding it's very effective in our communications. Next slide, please. So these are just some of the assets and solidarity items that we've produced to activate these stories. We've got the fans, we've got bandanas, tote bags, notebooks, postcards. We're using all of these in slightly different ways. So the notebooks are a little bit more premium. We're using these in a really sort of particular way to gift to decision makers, usually in quite intimate behind the scenes settings. Peter has now become adept at personally gifting these to high level decision makers. These are really designed to build that sort of long-term connection and memorability. They have a letter from the advocate inside that's written from them in the first person. So they're really beautiful. Then we have other things, you know, that we can give out a bit more freely, and the postcards as well. So it's a really nice suite of assets, and we will be activating these at lots of different moments in the coming months, and we have been doing so over the last few months as well. Next slide. Other activities. So hopefully everyone's aware we launched a global health security microsite. So this was really in response to us drilling into what our decision makers focused on at the moment. And global health security is absolutely one of those focus themes at the moment. So we've come up with a microsite. It's getting great engagement and feedback at the moment, which is fantastic. We're continuing to push it on our channels. We have a few different assets that can be used. There's the site itself, but there's also brochures that are being produced in a range of different languages, and there's a visual toolkit. Some of these assets you will find in the toolkit as well. Next slide, please. I think this is my last slide. This is sort of our final campaign activation that we are working on at the moment, again, in response to feedback on the themes and areas that decision makers are really focused in on. Return on investment, so how global health investments deliver significant returns. To do this or bring this to life, we've done a deep dive on Ethiopia specifically. And we've created a few different assets. There's a brochure, there's going to be a sort of social campaign around this. Again, this is to be used for sort of that direct targeted influencing with decision makers. I believe that the first of the brochure launched last week, but there are brochures coming in other languages as well. So watch this space. We will be adding to this activation, and you will start seeing this appearing on our channels. I think that's the final slide from me. So thank you so much, and happy to answer any questions. Thank you.
Great. Thank you so much, Charlie, and thanks for walking us through the various resource and materials that you and your team have developed. They look absolutely brilliant. So I hope everybody will be excited to go on the website and download and use those as well. So let me now open the floor up for questions and answers, reactions from the audience. If there's any, please feel free to raise your hand or just let me know, turn on your mic if you would like to speak or ask questions. I think both of you must have been absolutely very, very clear in your presentation. I do not see any questions or comments from the group. Again, I believe both of your PowerPoint slides will be available for sharing on the GFAN AP website. Is that correct? And that will make the links available for people to access. Rachel, would you like to make a comment or anything? I see your mic is off.
No, I just want to thank Ernest and Charlie for all the great work, and also our colleagues in the Secretariat for all that extra efforts and given such difficult circumstances. I think I just wanted to add a couple of things in terms of sharing with colleagues. This was something that was shared on a GFAN call earlier on regarding some of the information that was also shared on the call, so that people would be able to have more up-to-date information as well. Pauline, please feel free to add any further information on this call. So these are some of the pledges that have been announced or formalized so far. The date is based on the rates that are of 31st of August 2025. At this point, I'm going to pause. People would have already seen recently a global sign-on letter that we've asked people to sign on to organizationally for Germany. And Ken is going to share the link in the chat box as well, that we hope that you can further amplify through your various social media channels because of the risk of cuts from Germany. So we're looking for you to support us in amplifying these messages in the next couple of weeks before the World Health Summit that's going to be held in Berlin. So GFAN is going to be the Global Fund Advocates Network will be holding a couple and a series of events, including a session that's on debt to health. We're hoping that our colleagues from the Indonesia government will be able to attend, and really appreciate our colleagues from Indonesia that have supported us so far. Pauline, I see that your hand's up. Let me just finish some of this, the next couple of slides before I move on to you, if that's okay. So sorry. So I think maybe just to give people, I'm sorry, I'm not scrolling is difficult on thumbnails. So I think maybe just to give a quick overview of the last mile that's happening before the small virtual pledging conference that's at the end of October or in November, that will be very different from the usual pledging conference that the Global Fund Secretariat will be holding. So we effectively have less than 3 months till then for some of the last mile efforts that we would be looking at in the next few months. So we'll be looking for you to support us in some of the letters that will be reaching out to embassies in your countries, to some of the various donors that I've highlighted so far. Pauline, over to you.
Yes, thank you. Indeed, I mean, regarding the pledges that are on the first slide you show, that's in the spirit of the rolling replenishment that we had explained in previous calls and on the different GFAN call. So basically, we had so far two pledges from private sector, SIF, who multiplied by 5, and Takeda. We also had pledges from Norway, Luxembourg, Spain, and more recently Australia, who either like maintained or slightly increased. In terms of like pledges before the moment finale, next week will be a big moment with a number of announcements that will be taking place during the week of the UN General Assembly in New York. And then another platform also, I mean, but was, in discussion for potential platform is the World Health Summit, as you mentioned, Rachel, which will be a very important moment for our global advocacy. In terms of like the moment finale, so yesterday, I mean, 1 or 2 days ago, there's a statement that has been added on the website. We now have a date that is confirmed by the co-host. It's the 21st of November. It's called the Replenishment Summit. The save the date have not gone out yet, but at least the date is fully confirmed now. And as Rachel said, it will be very different in format from what we've seen in Lyon or in New York in the past. It will be like a 3-4 hour event in a hybrid format. Some people will be there in person in the margin of the G20 summit, and others will be joining online, like for the launch that we had. We'll be sharing more information in due time, and indeed, yes, and just seizing the opportunity, like to really thank you for your active engagement in those campaigns. You're signing the letters. There was quite a massive engagement on the Germany letter that Ken put in the chat here. This is very important. This is brought by our CSO colleagues in donor country to the attention of the decision maker. And the next few weeks are going to be very important for many donors. Sometime, because also you need to be like, those letters have to arrive at the right moment with the right message, right? And a lot of things happening at the last moment. So when you see, I mean, really, when you see a request for signing in the next 2 days, it is for in the next 2 days. So, and it is also because it is at that time that the impact will be most powerful. So very thank you for your reactivity and your solidarity on this. And thanks a lot to colleagues from GFAN AP and the GFAN family for really putting a lot of effort in these sign-on and other activities that is so important in donor countries to hear from communities and civil society on the ground, and and making the impact of the results that Ernest presented earlier. So thank you. Over back to you, Rachel.
Jennifer, you're moderating.
Oh,
Sure. Thank you, Pauline and Rachel, for both your comment and additional information and feedback. I see one more hand up. That's from Deepak. Can I have the floor over to you, Deepak, before, we close?
Yeah, thank you, Jennifer and Rachel. And
Can you introduce yourself?
yeah, thank you very much for update. I am a bit in a noisy environment, but I wanted to say something. And thank you very much for sharing the fabric creative. That is awesome. And hopefully this will create and connect more people, more donors. That will be good, creating good environment, enabling environment. And with regard to replenishment, I would like to ask Rachel, is there any effort that we have been making to go beyond the conventional donors and the private sectors who may be willing there is any effort that attracts more than conventional donors like previous, because we have been facing the new geopolitical situation. In this context, attracting more donors, more diversified private sectors would help much. What can we do together?
I think Deepak has raised a really important question, which I don't have a personal answer to. But Deepak, I think this is something that after the replenishment year is something that we will all be focusing on. A lot of our efforts this year has been ensuring that we are supporting country partners that have been really impacted by USAID in looking at other forms of domestic resource mobilization. So for innovative financing as a start, and we will be reaching out and looking more broadly to see how we can support countries in their efforts around domestic resource mobilization as well. It does not mean that we will stop advocacy around our donor governments. We do know that some of the public donors are the largest donors to the Global Fund. And this is why a lot of the efforts will still maintain and be prioritized with them. We follow the direction and complement the efforts of the Global Fund Secretariat in terms of whether we are reaching non-conventional donors. There are a lot of private sector and foundation individuals that we would be able to help support and follow up, but that depends on guidance from the Secretariat and to a certain extent, because we want to be able to complement their efforts and not give them a lot more to do. So it also depends on I think right now the focus is making sure that we do get to the 18 billion for this replenishment. After we can start looking at also furthering and strengthening some of the relationships that have been built over the last year. But I see that Pauline has a hands up and to react to Deepak's question.
I wanted to add also, I mean, to your very good points, Rachel, that as part of the Global Fund replenishment strategy, I mean, we have, yes, indeed. I mean, more than 80% of the resources of the Global Fund come from the G7 country, as you know, and 95% from public donor. So we're very much reliable on, major, our top major traditional donors. But, for many years already, we've been trying, starting to diversify our donor bases. And starting with, oil-rich country from the Middle East, and also new donors, as you know, India, Indonesia. I mean, Indonesia joined as the pool of donor from the last replenishment. The oil-rich country have been, donors. You could say they could do more, but we're working on that. So we're working on further increasing that base. For the private sector, you may have seen, or we mentioned in previous, updates. Last replenishment, private sector gave like a total of like 1 billion, and we set the target for this replenishment. The overall target is 18, and our target for private sector was or is 2 billion. So we're even more ambitious also on the share of private sector. So we'll continue on that. And as Rachel said, also like the innovative schemes like debt to health are really important. And like for Germany, for example, we've been like already implementing a lot of debt to health. We're in active discussion to further increase that aspect. So yes, but yes, indeed, more and more discussion for after the replenishment on these, because there are some needs. I mean, we're fully conscious of that.
Great. Thank you so much, Pauline and Rachel, and thanks, Deepak, for your really valuable question. I'm conscious of time. We have 3 minutes left. Is there any last-minute questions, comments, especially for our Global Fund colleagues who've been really kind making themselves available with us today?
So thank you all again for all the work that you're doing. We'll be reaching out to many of you again for all the work, for more work. Sorry, but we just have a few more months to make sure that we reach the target. If not, we'll just have to continue as we do in advocacy and activists. So thank you so much, Charlie, Ernest, and Pauline, and all of you. And thank you, and we'll see you very soon again. Bye-bye.